Welcome to your 2019 Prescription Benefit Explanation. This presentation is intended for members utilizing the prescription benefits offered by the Michigan Public School Employees Retirement System as administered by OptumRx. This recording will focus on the following areas of interest: how to maximize your plan's value by making the formulary work for you, information on your specific pharmacy benefits, how to utilize online resources offered by OptumRx, and getting personal assistance from OptumRx when you need it. Let's start our presentation today by discussing how OptumRx can help you receive the most value from your pharmacy benefit. We're going to begin by asking the question, why do some medications cost more than others? There are three major factors that affect what you pay for your prescriptions, including the formulary placement, the quantity, and the pharmacy you choose. A formulary is a list of drugs covered by your plan. Medications on the formulary are selected for their therapeutic effectiveness, safety, and value. The formulary is continually updated based on the latest research and clinical evidence. How much you pay for your prescriptions is determined by its placement on the formulary. Let's take a look at how the formulary is broken down. Tier 1 is comprised of generic drugs. Generics have been on the market the longest, first as brand products, then, when their patent has expired, as generics. Since generics have been around a long time, their safety and efficacy has been proven, and they are value priced to save you the most money. On average, generics will provide an 85% savings over their brand name counterpart. If you're not taking a generic drug, ask your doctor if one is available to treat your condition. Tier 2 preferred brand and preferred specialty brand drugs will cost you more than generics, but they're still a good value if a generic drug is not available to treat your condition. A preferred medication is a medication that has lower cost or is more clinically effective than a non-preferred medication. If a generic is not available, choose a preferred brand to maximize your value. Tier 3 and Tier 4 non-preferred brands and non-preferred brand specialty drugs are simply going to cost you more money. These drugs are covered because your plan provides you with the freedom of choice. But consider the cost and talk with your doctor if you're taking a Tier 3 or Tier 4 drug. Odds are your doctor can prescribe a generic or preferred brand that will safely and effectively treat your condition and at the same time save you money. Another factor that affects your out-of-pocket expenses is the quantity filled. When you have an acute condition, like a sinus infection, you will generally receive a 30-day supply of drugs. Something to keep in mind is that a 30-day supply may cost less at the pharmacy counter, but when treating an ongoing condition with a maintenance medication, a 90-day supply is in most cases a better value over the long run. Just like a Sam's Club, Costco, or other warehouse stores, members save more when they buy higher quantities. Maintenance drugs are those taken on a regular basis to treat chronic conditions, such as high cholesterol, high blood pressure, or diabetes. 90-day supplies are recommended for when therapy plans are already defined and tested. If you are working with your doctor to determine what dosage and strength will work best for you, we recommend 30-day supplies during this learning period to avoid wastage. Once you and your health team have determined the dosing regimen that is best suited for you, 90-day fills are a cost-effective, convenient way to access your maintenance medications. Another factor that affects what you pay for your prescriptions is the pharmacy you choose. Let's begin with retail pharmacies. Retail pharmacies set their own prices. You will find differing prices from one store to another, sometimes even within the same chain. Because your benefit has a percentage-based member cost share, the member out-of-pocket expense will vary depending on where you choose to fill the prescription. OptumRx's Price and Save tool is a great way to find the lowest price pharmacy option. Also, many retail pharmacies offer medications at lower prices using in-store programs. These programs work outside of your insurance. They can offer savings to members, but know that because the claims are not run through your insurance plan, any money spent using in-store programs are not included in your annual coinsurance maximum. There are two ways to quickly and easily find a retail pharmacy near you. You can use the pharmacy locator tool at OptumRx.com, or feel free to call OptumRx and a trained agent will be happy to assist in locating an in-network pharmacy in the location of your choosing. Now that we've reviewed retail pharmacies, let's take a look at mail order services offered by OptumRx. Mail order offers MPSERS members many advantages compared to walk-in or retail pharmacies. These advantages include affordability, convenience, and higher adherence rate. Mail order offers free standard shipping. If you currently use mail order, please note that in 2019, OptumRx.com now offers members the ability to track their medication shipments. Let's take a moment to discuss specialty medications. Specialty medications are high-cost, oral or injectable medications used to treat rare and complex conditions. Because of the high cost, high complexity, and sensitive shipping requirements, specialty medications are typically stocked and delivered by a specialty pharmacy. If you currently take a specialty medication, or if you should ever need one, OptumRx's specialty pharmacy, Briova Rx, does more than fill your prescriptions. Briova Rx is more than just a specialty pharmacy. They are an educational resource for our members, a 24/7 support system, and a trusted advisor to every member needing their support. Briova Rx has a staff of clinical experts who personally guide patients through their prescribed treatments to ensure safe, effective, and timely administration. We offer thorough education on all medications we offer, including injection teaching and our proactive refill reminders. Fast free home delivery make it easy for patients to adhere to their treatments without disruption or delay. In addition to a personalized member approach, Briova Rx offers exclusive savings to MPSERS members. Medicare members will receive lower costs exclusively through Briova Rx on their preferred medication. Non-Medicare members are required to utilize Briova Rx to fill specialty medications. Let's turn our attention to your 2019 out-of-pocket costs. Your 2019 copay. For generics and preferred name brand, the member cost share is 20%. This coinsurance includes a $10 minimum and a $40 maximum per 30-day supply. The 90-day coinsurance includes a $25 minimum and $100 maximum. A 90-day fill of a generic or preferred brand name drug is your best value. For non-preferred drugs, the member cost share is 40%. This coinsurance is combined with a $10 minimum per 30-day supply and a $25 minimum per 90-day supply. Please note, non-preferred drugs do not have a maximum copay. Let's take a moment to discuss your copay minimums and maximums. Here's how it works until you reach the coinsurance maximum. If the cost of the drug is less than the per drug minimum, you pay the cost of the drug. If the cost of the drug is more than the per drug minimum, but 20% of the drug cost is less than the minimum, you will pay the per drug minimum and your retirement system pays the rest. If the drug price is higher than the minimum and 20% is lower than the maximum, you will pay 20% of the drug cost up to the plan maximum, and the retirement system will pay the rest. Please note, non-preferred drugs do not have a per drug maximum. Let's take a look at a 90-day copay example for a generic or preferred name brand drug. Reminder, the member cost share is 20%. The 90-day coinsurance includes a $25 minimum and $100 maximum. If the pharmacy retail price is $1,000 per 90-day supply, the member will pay 20% up to the plan per drug max of $100, making a copay on a $1,000 preferred drug $100. This is a great value. Compared to a non-preferred brand of a $1,000 drug price and a 40% coinsurance with no per drug maximum, resulting in a member copay of $400, it is easy to demonstrate the value of preferred drugs. If you need assistance locating a preferred drug, please visit our website or call the number on the back of your card for assistance. Now let's discuss the annual coinsurance maximum. The annual coinsurance maximum protects you financially by limiting the amount you pay for medications. The annual coinsurance maximum remains $1,500 per person per calendar year and will reset on January 1st, 2019. When you use generic and preferred brand name drugs, the full amount you pay is applied to the annual coinsurance maximum. When you reach the annual $1,500 coinsurance maximum, you will pay $0 for generic and preferred brand name drugs for the remainder of the calendar year. If you are using non-preferred drugs and paying 40% of the drug cost, only 20% of the generic or preferred drug cost is applied to the annual coinsurance maximum. If you pay the per drug minimum, the full amount applies. If 20% is greater than the per drug maximum, only the maximum will apply. You can get help and answers to your questions with just a few clicks. Find forms, plan details, and answer to your questions on our website or mobile app. The OptumRx consumer portal is located at www.optumrx.com. The newly redesigned OptumRx consumer portal offers a convenient way for members to take care of many of their prescription needs. With a virtual medicine cabinet, the ability to access other member accounts in your family, and an at-a-glance section including most of the tools that you would need to manage your prescription benefits, OptumRx.com is a great resource. On our website, you can view and print your medication history, learn more about your medications and keep track of your health history, order medications from OptumRx home delivery, download and print important forms and documents, including membership cards, review the formulary, and most importantly, compare costs on your medications using our online drug pricing tool. To take advantage of these member tools, please visit www.optumrx.com and register today. Good health is in the palm of your hand with the OptumRx mobile application. With the OptumRx app, managing prescriptions is quick and convenient. Easily refill or renew prescriptions, transfer retail prescriptions to home delivery in a few easy steps, and get personalized service with the OptumRx app. You can compare medication prices and save on lower cost options, track your home delivery order, and find pharmacies near you, all from your smartphone or tablet. The OptumRx app is available for Android and iPhone. Please go to your app store and search for OptumRx. Of course, if members ever need personal assistance, We have well-trained staff here to help you find the most value in your prescription benefit. If you have any questions about any of the information in this presentation, or if you have any other prescription benefit questions, please call OptumRx Member Services. For Medicare members, that number is 855-577-6517. Non-Medicare members, please call 866-288-5209. OptumRx is staffed 24 hours a day, 365 days a year to assist. This concludes the summary of your 2019 pharmacy benefit provided by the Michigan Public School Employees Retirement System as administered by OptumRx. Thank you.